Okay. We're having some technical difficulties, so hopefully everyone can hear and see us. Lisa, does it sound okay? Can you hear? Can somebody give me a thumbs up or a yes if you can hear me? Oh, Connie says yes. Okay, great. Okay, well, welcome everyone. This is our April health literacy training, and today's topic is a plain language workshop. So what we're going to be talking about today is a little refresher on plain language tips. So how to write and develop clear communications so that people understand. We also are going to have a lot of time at the end to look at lots and lots of examples and kind of discuss and talk about how things can be improved. This was a workshop where we did invite any participants to share their materials with us beforehand. I don't believe we got any, but if there's anything that, any questions or anything that you'd like to ask during this workshop, we definitely left the last half for more of an open discussion. So please bring your questions around your specific materials or your specific needs. And I forgot to introduce myself, but my name is Megan Rooney. I'm with Health Literacy Media, and I'm joined by Lisa Carey. And we are working with the Kansas City Health Department to put on a series of health literacy trainings covering a wide array of topics centering around COVID-19 and vaccine communication, but also health communication in general. So that's us. A couple things before we begin. We will share in the chat at the very end a link to a post-workshop survey. We hope that you fill that out for us. We're also going to send you a 1-page or 2-page maybe summary of what we covered today. I'll also be pasting in the chat a link to our in-person workshop that's happening at the end of May that we would love for people to join. And so I will throw those links in at the end, but feel free to turn your camera on and interact with us. We can definitely answer questions and talk throughout. It can be very interactive if you like. So here are the topics for today's discussion. We're going to quickly define health literacy in plain language. I know a lot of you have already attended these trainings, so you're becoming experts on this. We'll talk about how do people with low literacy read. Then we'll get into some very practical tips for writing. And then at the end, as I said, we will workshop some materials and talk through some changes that we made to some existing materials. So health literacy, again, many of you have seen this. We like to define it as personal and also organizational. And it's the degree to which individuals or organizations can find, understand, use, and use information and services to inform decisions and actions. On the organizational side, it's about equitably enabling individuals to find information to take action. Plain language is a term that we use, but we often like to define it so that we're not using jargon. But it is one of the most fundamental health literacy principles. And it is at its basic form, it's communication your audience can understand the first time they read or hear it. Sounds simple, it's actually quite complicated. So here's just an example of what plain language looks like to us. So on the left, you see content for a patient report after they had had some genetic testing for their risk of Alzheimer's. And on the left is the before, kind of the draft version. It was just black and white content on a page. And on the right, you see our design, our redesign of this content. And so this is just the cover page, but we use this same design throughout. So you can see how there's a lot of white space, there's color, there's icons and graphics, there's small bits of information for people to process so that they're not processing many, many paragraphs all at once. So how do people with low literacy read health information? We know that there's a skills mismatch between what the average US adult reading level is, which is 7th to 8th grade. And I will add that research shows that people actually understand a few grade levels below what their actual reading level is. Most health materials, based on a more recent study, is at around the 11th grade. So if you think if people are understanding 5th to 6th grade reading level and materials are at the 11th grade reading level, there's a huge mismatch there. And so one of the things we can do to bridge that gap is plain language. So we know that people with limited or lower literacy, this also applies to people who are under stress, people who are new to the English language, younger readers. We know that some people have problems with memory. They might get stuck on long or difficult words and maybe have trouble finding what is the most important information, kind of trouble reading and synthesizing. What are the main points here? And so to compensate, people read slowly, they reread words and sections, they skip words, they might start in the middle of a paragraph, and they might try to literally read every word instead of skimming. Skimming is a more sophisticated skill. So here's just an example of a person with low literacy. So this is an eye tracking study. A person with low literacy trying to navigate the document on the left, which was content before a plain language revision. You can see that their eye moves and stops at 100 or more different places throughout the document, and it's in a very random order. So there's no kind of logical flow to their reading. On the right, you'll see a plain language revision of one of these pages. And you can see that based on eye tracking, it's a much more organized flow through the document, because that is what plain language does for people. It allows them to kind of guides them. So less work on their part to move through the document. So I believe Lisa is going to speak for a little bit now on our 6 tips for writing clear in health information. Oh, Lisa, we can't hear you. I'll get it going, Lisa, while you're figuring out audio. Okay. Okay. Our first tip is making your audience and purpose clear. And you want all of your content and your graphics to match your audience's needs. So here's an example on the left of a before example from the CDC. This was this is not necessarily for patients. It's a little bit more for professionals, but we do know that everyone from early readers or low literacy readers to professionals with a high education prefer documents in plain language. So we're doing this, it's a universal precaution. We're doing this for everyone. So you look at this document and it's called National Violent Death Reporting System, fiscal year 2014 background document. So do you feel that you understand what this is about just by reading the title and maybe skimming the headings? Feel free to put your answer in the chat or unmute yourself. No, I would agree. So what's the problem here? This is a very vague, kind of jargony title that, if you read this, you wouldn't know if this was for you. You wouldn't know if you were even interested in this. So here's a revision of this. The National Violent Death Reporting System provides data that can help state and local health departments develop evidence-based strategies for reducing violent deaths. So this not only gets at the purpose, but also the audience. So it mentions state and local health departments. So you might be able to glance at this, and that's kind of the key here is you want people to glance at something and get, oh, what's this about? And is this for me or not? So this does a much better job of answering those questions. So in the chat, feel free to let us know your thoughts. Here's an example, actually from the KCHD website. At first glance, what is the purpose and who is the intended audience? Or does it take you a couple minutes to figure that out? I'll let you read that. Do you feel like the purpose is clear? It says not addressing the public. It wouldn't be clear to someone immediately, right? At first glance, it's just, obviously it's about measles and polio, but it's not telling me exactly what I'm going to learn. And it's not telling me if this is for the public or not, which I think someone said. So how about this one? Health Department brings COVID and flu vaccines to downtown KC. Building immunity before winter. What do we think about the purpose and audience of this? Is this one clear or clearer? Connie says yes. Joey says yes. Yeah, so it's talking about COVID and flu vaccines, which speaks to the public, which speaks to people who generally know that they need to get their vaccines. Whether they do it or not is up to them. So clearly this is a message for the public, and the purpose is also clear that there are going to be vaccines coming to downtown Kansas City. If you are interested in that, you would read more to learn, oh, where can I go to get those? Lisa, are you connected now?
Yeah, I think so. Can you hear me?
Yes.
Okay, great. Thanks. All right. So our second tip here is to make your content easy to navigate. And by this, we mean helping the readers who are on a journey through your document, helping them find the information that they want. So there's kind of two different types of information. There's the need to know information that is, it's about an action step. It helps readers make decisions about what they're going to do after they read your material. And so that would be something like how to use an inhaler. And, you know, maybe one of the statement about that could be, or a statement like the COVID-19 vaccine is safe and works well. Millions of people worldwide have already gotten it safely. That's a definite statement. Nice to know information is information that won't really help a patient take action, such as, you know, many people in the US have asthma. That's totally different from how to actually use an inhaler. And as far as COVID-19 goes, it could be a statement like, vaccines have been around for a long time. The first ever vaccine was developed in 1798. That doesn't help anyone decide if they're actually going to get the, go ahead and get a vaccine or not. So let's see, I'm going to, okay, thanks. So the next thing is to find the most important information. And that would be something like, here's a slide that shows how to schedule a telehealth appointment. And I think, Megan, are we going to launch a poll? Or just to see, so you can see, if you read these, you need to maybe put them in a certain order so that they make logical sense. And so that the most important information is at the top. And we'll give you a minute to read these.
Hopefully everyone can see that Zoom poll. I think I only see 2 responses so far, so let us know if you cannot see that Zoom poll. Sometimes if you can't see it, your Zoom might need to be updated. But basically, it's a ranking quiz. So you'll read through those 4 statements and then decide which one should be first, second, third, and fourth.
And if you can't see the poll, go ahead and put it in the chat.
Okay, I see we got a 3rd participant. Sounds like Connie cannot see it. Yeah, sometimes if people can't see it, I think it might be an outdated Zoom, but that's okay. You still can get the gist of it. I'll give you like 1 more minute to see if anyone else wants to participate. Okay. So Connie says 3, 1, 2, 4. Okay. I'm going to share the results. Well, I don't think that. Yeah, this
I
one.
can see the poll,
I'm going to
but
show
not
you.
the
I'm going to show you
result.
what we did here on the slide. So here's how we reordered it. So we reordered it exactly as Connie stated. I can't tell from the quiz what other people chose, but we would recommend defining telehealth, giving you a little detail about that, what you'll need. So that allows you to just understand what it is and to understand if you can even do it. You know, do you have a camera and a microphone? And then here's the action step, how to do it. And then a little bit of a tip for when you call to have your card ready.
Okay. Our second tip on for kind of organization or structure is to use large, bold headings. And this is really important so that, because when people read information, they tend to want to scan through it. And these large, bold headings are kind of like your road signs on the journey through the material. So you want to build different levels of information that help people, help orient your readers. So you can see here on this one, there's a main title, and usually the title is the largest and or boldest of the text on your page. Then there are headings, and on this page, the headings are in those dark green boxes. And then there are subheadings in the gray boxes. So there's this hierarchy, and using consistent formatting for the different levels of headings and subheadings helps the reader make their way through your document. The next thing is to use bulleted lists strategically. So again, building in levels. What do you think about this one? We know that we love bulleted lists. They make things easier to read, usually. The issue we have with this one is that it's nothing but bullets. Um, Turning something into bullets, when it's that many, just all in a row, really makes them less effective. And so this would be the answer that we would like, grouping the different bullets into related groups and adding these bold kind of headings or lead-ins to them. So all of the bullets that are about, how will the initial vaccine efforts work are all, the 4 of them are under that first chunk. And doing this again helps the readers skim through to read the headings and see the information that they really want. And so we would say that you should limit lists to 3 to 5 items. And then again, like this, if you have more, group them under separate subheadings or lead-in statements. Each bullet should be, usually we try to keep them to 1 sentence a piece. Sometimes you need to have 2 sentences in a bullet, but no more than that. And then for items in a certain order, use numbers, a numbered list instead of a bulleted list. So for example, here we have in the lower left corner, number 1, get your first vaccine. Number 2, 4 weeks after your first vaccine, get your second vaccine. And then number 3, 6 months after your second vaccine, get your booster shot. So they go in order. Okay, so the next strategy is to use clear words and sentences. And this is what most people think of when they think of health literacy or plain language. We would say that you should try to write the way that you speak in everyday language, using those familiar words that you use when you talk to your family or your neighbors or your partner. So here on the right, we have some jargon terms. And in the chat, or you can unmute, think about the word glucose. There are 2 ways to handle jargon. One is to, if it's a word that you think the readers need to know, you would define it the first time you use it in the material. And if it's a word that could be replaced with a more simple sort of something that, a word that means the same thing, and it's a word that you don't think that your readers really need to know, you could replace it. So I would say that I'm just going to do this first one. So glucose is blood sugar. And if someone has diabetes, they probably need to know the word glucose. What do you think about on behalf of? Do people need to know that phrase or term? And if not, what could you replace it with? Kind of a tough one. Who's recommending? Okay.
So it sounds like just stating the doctor or the agency recommends.
Or, okay. And just saying for instead. Yeah, that's a hard one. What about transmission? Probably in the context of a virus. Is transmission a word that readers would need to know? Transmission needs to know more also.
Mhm.
Oh my God, bye. Okay. Yeah. It depends on the context of your material, but you could replace transmission with spread. The virus spreads from person to person. So again, this is an art as well as a science. These are based on evidence, but you also kind of need to make judgments depending on, again, your purpose and your audience. So now we're coming to active voice, and feel free to unmute and ask questions or put them in the chat at any point. So active voice is when the person or the object who's doing the action, and we call them the actor, comes before the verb or the action. So let's look at some examples. Here's an example of passive voice. These strategies have been followed by many writers, and you can see the verb followed comes before the actor. So people reading the sentence don't know who's doing what until the very last word when they see that it's writers. So instead, the active version would be many writers have followed these strategies. Actor comes before the verb. Here's another passive voice example. The webinar has been presented. You're not sure who presented it because the actor is not stated, it's anonymous. Instead, you would find out who did the action. The writer presented the webinar, and that makes it active. So here we go. Here's a quiz based on what we just talked about. Read the 3 sentences below and then decide, is each one active or passive? So sentence 1, the test can be found at your local pharmacy. Think about who the actor is. And you can see the poll there where you can make your answers, or Connie, yes, good, you can put it in the chat. Okay. All right. So Connie thinks it's passive.
Oh, I think I clicked the wrong thing. This is Connie, sorry.
All right.
I clicked the one that I thought was the active, I think.
Oh, okay.
And
Sentence
I did
2.
it before I saw the poll too.
Okay. Well, I'm glad you're seeing the poll. All right, yeah, go ahead and do all 3 sentences,
Okay.
and then Megan will reveal. Hopefully we'll be able to see the results. Okay. All right, so that first one is passive. The test can be found at your local pharmacy. Who's finding the test? You don't know. The second sentence, your local pharmacy has the test. You know what's going on. Local pharmacy is the actor, and has is the action or verb. Sentence 3 is also active. You can find the test at your local pharmacy, you being the actor. Okay. Great. Next is to use clear numbers and give them meaning. I don't know how many numbers you use in your materials that you create, but we have a few strategies for making numbers clear, using only the essential, clear, and meaningful numbers, and then also doing the math so that your readers don't have to. All right, so here's an example of using only necessary numbers. And if you look, there are two different examples here. The one on the left is a letter that starts out, according to a national survey, more than 82% of American adults had contact with a doctor or other healthcare professional in 2016. Do you think that those numbers are necessary to help someone make a decision or take action? Go ahead and put it in the chat. Oops. Oh, I think yeah, there we go. Yeah, okay. Okay. Miss Gigi says, yes, the more information we have, the better decisions can be made. That is true if the information like this doesn't muddy up the actual, core message of what you're trying to say. One thing that you could do we would say that this is not essential information, and maybe what you could do is move it down further in the letter so that people can get right to that second paragraph. As a new recipient of Medicaid, it's mandatory for you to choose a primary care physician by May 1. That's really the most important information in this. So let's look at the second example. This is a little piece of information, a section from an informed consent form, and it's telling people who are thinking about getting a procedure how many people, 1 in 100 people, will bleed a lot after a growth is removed. And then 1 in 1,000 people will get a hole in their large intestine. So imagine if you were a patient who was thinking about getting a procedure, is this information that you would want to know before you decided? We would probably say yes, that you would want to know how many people were going to, what your chance was, what your risk was for bleeding. Okay, this one is about doing the math for your audience. Are these numbers necessary? So doing the math for your readers means that they don't have, if you have numbers and something needs to be calculated, sometimes people haven't had math for many years and they may calculate it the wrong way, or, if it's something where it's something like personal, like calculate your body mass index by taking your weight, times something. If they're needing to figure it out for themselves, explain how you did the math and show an example so that they can follow the example. And so I think we have an example here. So this is from during the pandemic, and there were the pandemic EBT benefits that people get when they have the SNAP or food stamp program, and the recipients were this was something that the Family Support Division in Missouri put on their website because there were, during the pandemic, the kids who were getting free school lunches through SNAP were not going to school, so they were missing out on those free school lunches. And so the SNAP program figured out the benefit amount based on, the average number of school days when schools were closed from March to May, and then the cost of a free and reduced lunch. And so they figured out that people were going to get about $302 per family or per child. So it was great that they showed how they arrived at that number. The next one strategy that we're going to talk about is to highlight the action steps. And we've been talking about this. So much of our material is helping people make a decision or take action. So you want to make sure that when people read your material, they can see what the action is that you want them to do. And so you want to avoid vague actions or instructions. And so, like, use a clean face mask. Okay, that's fine, but how could you make this more specific? Something like wash a reusable face mask every day and throw away disposable masks after wearing them once. That's much more specific, so people are going to be more successful at taking this action. The second big one is stay away from other people if you have COVID-19. Well, okay, again, that's vague, and the more specific one would be something like stay home if you have COVID, stay in a specific room away from other people and pets, wear a mask whenever you leave your room, and use a separate bathroom if possible. So again, they're much more likely to be successful with that instruction. The next strategy is using meaningful design and visuals. And you can see here what kind of an exciting looking material would be about, what to do if you've tested positive for COVID-19. It's got a really nice visual up at the top. It's got, a heading in green, icons down the side that kind of help cue the reader as to what these various topics are about. And then it has symptoms over in a little gray box on the right. So all of these things combine to make it appealing and nice to look at. And on the other hand, it also has enough white space that it doesn't look too crowded. So let's talk about white space. This is an example of what not to do for white space. It's really crowded, and even though they put things in a numbered list, it is really, it looks like just a full solid block of text because there's no white space in between the different items. And so again, you can see that these different items here have white space in between. It helps to keep line lengths to 30 to 50 characters or, letters and the spaces in between, because that makes for bigger margins on either side and more white space. You can use line drawings, icons, photographs. Studies show that faces are the most interesting to people. So use faces or photos of faces or people when appropriate. And then you can use bolding, text boxes, color to highlight important points, and then highlight the action items with bolding. So let's talk about fonts. It's always good to use simple fonts like the ones that KCHD used for this web page on lead poisoning prevention program. It's good to use sentence case, and that means you're only capitalizing the word at the start of a sentence. And you can see in this heading that the arrow is pointing to, this is title case, where every word is capitalized. It just makes it a little bit harder to read because people are used to sentences. We also say to use at least 12 to 16 point size font, size 13 or 14 for older adults or people with visual impairments who may have trouble seeing regular, size 12 font. And then size 16 is the best size for website body text. Okay, I'm going to turn it back over to Megan for workshopping.
Okay, thank you, Lisa. So we've got about 15 minutes left. We have slides with lots of examples to show you. And this is also the point where we really encourage you to ask us any specific questions you have. If you have any materials pulled up at your desk, or things you've seen or are working on and have questions, please feel free to ask us and we can kind of talk through it together as a group. But as you're kind of thinking through that or seeing if you have any questions, we're just going to kind of walk through some examples. And we would ask that you think about the tips we just shared. So the 6 main tips: purpose and audience, clear organization, clear content, clear numbers, action steps, focus on action steps and behaviors, and then clear design and layout. And just kind of give us your best assessment for what's going on here on this document. And then we'll show you an example on the right. So how do you feel, like what do you feel is going well and what's going not so well with this one? Feel free to unmute yourself or use the chat. What do you like? What do you not like now that you're armed with the plain language knowledge?
This is Connie. It took me a few minutes to figure out what they were really trying to highlight here. And then, I don't know, it just took me a minute to figure out what they were trying to really highlight, even though they have the Medicare savings for qualified beneficiaries in the middle.
Right. So you kind of get it. You're like, okay, it's about Medicare. It's about savings, but you're reading it and you're having trouble figuring out. So that's a purpose problem. What is really the purpose of this? Miss Gigi, I think print on the bottom is too small. Additional information is needed. Yeah, so the print is very small at the bottom and probably not enough information to help you really understand what's going on here. So here's a suggested revision. The Medicare savings programs for people in Missouri who have a low income and need help paying for Medicare. So we're immediately getting at purpose and audience right up front. So then what are Medicare cost savings programs? So then again, getting at purpose there, right away, it's about the savings programs, and we're going to define that for you right up front. So here's another one. I'll give you a minute to read through that and tell me, based on all the principles we just went through, what do you think which one would really help improve this?
I think it would help if they broke that paragraph up a little bit. And they also don't tell you a contact for all of this information.
Mhm. Yeah, I would totally agree. Breaking this up, it's a pretty wordy paragraph. So breaking it up, this is a perfect place for bullets. So if you read through it, there's actually 3 things that this program pays for: your premiums, your deductible, your co-insurance. So kind of pulling that out, putting it in bullets, you can see how the bullets and the bolding helps your eye kind of move through, but also helps you conceptually structure the what the program pays for in your mind. Oh, okay, it pays for these 3 things. You might not get that out of that first paragraph. It's requiring more work. Jocelyn, it's hard to know what to focus on or what to do with the information. Yeah, so there's clearly also information missing, and hopefully this, goes on to explain more about how the program works and how to use it. Yeah, this is definitely not enough to fully understand the program, but the whole point of plain language really is to lower the workload of the reader. How can we just lower the work that they have to put into reading and understanding? We just looked at this one. So this is about lead poisoning prevention program and Project Lead Safe in Kansas City. And so if you read through, so we've got the questions are, what can these programs do for me? And then it kind of lists the 2 programs: to get tested, what to do, and what if I think my home has lead paint. It's not terribly organized. We had a suggestion for how it might be reorganized to help with a more logical flow of the questions. So what is lead poisoning? So we might just start with that. What are we even talking about? A lot of us know what lead poisoning is. A lot of people might not. They might not understand why lead is an issue. What is lead testing? So defining lead testing, and then going into, there are these 2 programs for children and for homes. And then how can I get my child or my home tested? So then we move to the action item. So we kind of needed to build in a little bit more education at the top, explain the programs, and then we get to the action item. So this is kind of a structure and organizational principle here that we applied. So read through this and tell us, what do you think the problem is? Kind of what's the number 1 biggest problem with this paragraph? What's going wrong with this paragraph? It's not doing everything right. It's doing some things wrong. So I think some of you might say, break it up. It keeps going back and forth with the however, and it talks about quarantine compliance. So it maximum incubation period. So it's not organized. What about the words it's using? So to us, when we read this, and we think about saying this to, our grandmother or a small child, think about how you would say this to your neighbor. Would you explain it this way? You probably wouldn't use a lot of these words. So quarantine, maximum incubation period, impose, personal burdens, cause economic hardship, reduce compliance, increase community compliance, jargon. So it's full of jargon. So here's a revision. If a person has been in contact with someone who has COVID-19, they should stay away from people, in parentheses, quarantine. So defining quarantine. This is the longest time it takes for an infection to start. So it's explaining why 14 days. But this can be hard on your health and your earnings. So to help people in our community, we want to shorten the time we recommend for quarantine. So explaining like what's the whole purpose is we're reducing the time, and here's why. Joey, it recommends 14 days, but it doesn't really recommend it. Yeah, right. So it's like saying we recommend this, but that's really hard. So it's not really saying to do it. So I think the whole point of this paragraph was the CDC is changing the rules. So trying to make that more clear. But you're right, getting at like, what is the action step? What are you telling me here? So you can see how we replaced a lot of this jargon. So here's another example. Show Me Healthy Babies aims to be a catalyst in helping to address the critical healthcare needs of women who are pregnant or who currently live in Missouri. I'll give you the answer to this one. To us, this just feels very wordy, and it seems like very kind of, how do we say, kind of public health ease, I guess, where, these are ways that many of us have learned to write, or we read things like this. And so we kind of naturally write this way, but we can also just say things the way we'd say it to someone. So Show Me Healthy Babies wants to help pregnant women in Missouri get the healthcare they need. So we don't need to talk about catalysts. We don't need to talk about addressing. We can just say, it in one quick sentence the way we would say it to a person. So here's two examples to compare. So typically it takes approximately 10 days for information to be processed. You will receive a letter in the mail once your case has been updated. And the revision is, it usually takes us about 10 days to process documents and information. You will get a letter in the mail from us once we have processed your case. So the deal here is, I believe, is passive and active voice. So information to be processed is passive voice. So adding the first person, us, makes this more active, makes it more personable. It sounds like someone's talking to you. It's not sounding like a computer is just, blurting out information to be processed. We would say it takes us about 10 days to process. Yeah, so we removed the passive voice there. I'm going to move actually to the last two because they're a bit more design focused, and I would like to cover that before we go. So here's an example. This example is pretty good. You can see that they're using bullets, that they've explained their points very clearly in each bullet. It's easy to read and follow. This is an extra little design hint, but we can make things interactive. And by doing so, we encourage people to actually use the document in a different way. So instead of just listing information, thinking in a more creative way, how can we present this in a different way that's more fun, that's more exciting for people? So are you permanently and totally disabled? Yes or no? Are you 16 to 14 years old? Are you employed either for yourself or others? Do you live in Missouri and plan to stay? So if you check, encouraging people to check those off. There's also research to say that the more people interact with a document or a website or any sort of material, the more likely they are to keep it and also to process it and remember it. So just adding in those little creative ideas can really help people understand health information. And then lastly, another design trick that we like to use sometimes is tables. so this is a lot of information on the left. It's doing good things like using headings. It's using bullets. It's using white space. So it's not terrible. But if there's ever a time where there's kind of a pattern to the information, like there's a category and information, a category information, consider a table. So here we put in on the left column, these are the repayment methods. And then on the right column, this is just the explanation for it. So these are kind of categories, or there's a pattern to the information. A table can help people move through it in a visual way. I will say that for accessibility, tables can be a little more complicated for people who use tools like screen readers. There is a way to build in accessibility in tables, but if you know that you're going to be, a lot of your readers or users of your website do use screen readers, you might avoid tables. Just a little accessibility note. So lastly, we just are sharing a couple of resources with you. These resources will be on the summary sheet that we send out after the training. And then here I want to mention, again, our next training. So I'm going to place, see if it'll let me do this. First, I'm going to copy our survey into the chat. So if you have a moment, please fill that out for us to let us know how the training went today. I'm also going to paste in, and I'm hoping this link works for you. I'm pasting in the Eventbrite link to our May training. This is going to be, you can pick either the 24th or the 25th from 9 to 12. And we're going to be discussing organizational health literacy. So how to improve your organization's practices and services internally and externally to your communities in order to help people understand and use your services and navigate the system. So it's kind of moving a level up to what can organizations do to improve health literacy. So there's that link right there. If you'd like to register, we will be in person. So some of our staff will actually be at KCHD, the health department site, and we will be doing that workshop together. We'll have breakfast and snacks and coffee. But that is it. We are at exactly 11 o'clock. Thank you everyone for participating, for being here today. And we hope to see you in May. Thanks, everyone.
Bye.
Thank you.
Bye. Thank you.